In November 2 years ago, a law was passed allowing medicinal cannabis to be prescribed by doctors to help treat patients with epilepsy, MS, or for people going through chemotherapy.
Yeah, however, since the law was passed, many patients have struggled to access the drug, and it seems doctors are reluctant to prescribe it. In a moment, we're going to be talking to Hannah Deacon. Now, you remember Hannah, she's been on the show before. Her son, Alfie, was the first child in the UK to be prescribed cannabis oil. We're also talking to neurologist Dr. Mike Barnes, who's a specialist in medicinal cannabis. First, though, we're going to talk to Matt Hughes. And Matt is going to go to the High Court to fight the current guidelines. This is in a bid to help his son, Charlie, who suffers from a rare form of epilepsy. Matt, good morning to you. Tell us about Charlie. He's 3 years old. When was he diagnosed with epilepsy and how bad is it?
So Charlie was diagnosed at 10 weeks old with a severe form of epilepsy called infantile spasms, or West syndrome as it's known. So being so young, the brain's still developing, and basically it's chronic brainwave activity. So it's not in a rhythmical state. And that has a detrimental effect on his development as well. So obviously through them early years, all them little milestones that babies reach, Charlie wasn't reaching any of them. So he's now turned 3 last month, but his development is that of around a 1-year-old. Okay. So yeah, it's been catastrophic on his development, and doctors will always say infantile spasm.
It's very interesting. You've got awful sound there, unfortunately, Matt, which hopefully somebody can twiddle a knob and reduce the echo that we're hearing here. But basically, when Hannah went through her situation with her son Alfie, we thought from the Home Secretary that was the green light. And there is this reticence from the governing body on this NICE to actually take their mitts off this prescription. It's one thing saying, yes, you can have this, but why are doctors afraid to prescribe it? Essentially,
everything we've been told is the NICE guidelines. So we've now got a NICE challenge against NICE in the High Court. So essentially, the guidelines that they've written are so restrictive. Although they do allow it, it's so restrictive that doctors don't have the confidence to prescribe. So essentially, we're asking that they're re-reviewed, that the guidelines are using modern evidence and new evidence here in the UK, and anecdotal evidence as well. So NICE are relying on randomised controlled trials, which cannabis doesn't fit into that model. Randomised controlled trials are designed to test pharmaceutical medicines. Cannabis is a plant, so it doesn't fit that model. So
really... I was reading that Charlie hasn't been prescribed cannabis by the NHS, but you have been getting it for him privately since May last year. So tell us, he was having 120 seizures a day, I believe. Tell us the effect that the cannabis has had on Charlie since May last year.
So we started using, as you say, May last year, and initially he's really alert, he's really happy. He come alive. So before he was really lethargic and he's suffering some side effects from the other anti-epileptic medicines. And yeah, he's just come alive. But then we started seeing the seizures reducing. So they reduced from 120. We had weekends where he was seizure-free. But now, he's been using it for over a year, and it's, they're no more than 20 a day. And they're not as severe. They're a lot less. They don't really bother him that much. It's had a dramatic.
So as a result, Matt, you're now taking the National Institute for Health and Care Excellence to court, and they are effectively preventing the NHS from prescribing what you need for your boy. Let's go to Hannah Deacon now on this, and your son Alfie, as Ruth said earlier. Alfie's now 8, was the first to get cannabis on NHS prescription. Probably at the time, Hannah, you thought, job done. Politicians make these big announcements and the public then die down. The public go, oh, right, that's all sorted then. Why is it not sorted?
Well, you're absolutely right. We were very, very proud that the law changed on the back of the campaign that we ran with End Our Pain. And actually, the reality is that nothing has changed for people. What's crucial to remember is that there are groups of families like Matt's family who have been left high and dry by this failure in policy. They're having to raise money all the time, especially through COVID, which has been extremely difficult. And that's the only thing that's keeping their children safe and out of hospital, and actually not using NHS funds for looking after their children. So this medical cannabis, these private prescriptions are, saving their children. The law was changed, and NHS England said, yes, you can prescribe as doctors can prescribe as any other normal medicine, but the hospital trusts are saying, no, you can't prescribe. And NICE and other medical bodies are saying, no, you can't prescribe because there's not enough evidence. So it's just a complete mess. And in the middle of it, we have very vulnerable people with very sick children who just are desperate to get this sorted out. The one person that can actually sort this out today and can intervene is Matt Hancock, the Health Secretary. He met with families.
You've got two hopes of that. No hope and Bob hope, I would say. It is so controversial. And I want to go, Hannah, to Professor Mike Barnes to find out why it is so controversial. Mike, you are a consultant neurologist and medical cannabis expert. You heard what Hannah said. Quite simply, the Secretary of State for Health, he could make this happen. We've heard the Home Secretary before pretending to make this happen. It hasn't happened. Why do politicians want to run miles away from making a decision on this?
I find it extraordinary why they do. It's a remarkably safe medicine. We know that for certain. We shouldn't forget that in this country, there's 1.3 million people use cannabis for medical purposes every day. So we know about its safety. We know it can work. Yet, for whatever reason, NICE has come out with a guidance that says we shouldn't use it because they don't think there's enough evidence, which is actually nonsense. What they've done, as Matt said earlier, is look at it as a pharmaceutical product. You can take aspirin and you can compare it against placebo and see if it works for a headache, but you can't do that with a plant. So a plant needs assessing of its efficacy and its safety in a different way. And there's a huge amount of evidence that shows that cannabis, medical cannabis, can be useful for pain, for anxiety, and particularly for today, for childhood epilepsy. That evidence is overwhelming, yet they've chosen to ignore it.
Why do you think that is, Professor Barnes? Why have they chosen to? I mean, you're an expert in this field. You said the research is there. Why are they choosing to ignore it?
I think they're looking at it as a pharmaceutical medicine. They're trying to push it down a pharmaceutical route. They say there's not enough double-blind trials, which means that the patient and the doctor don't know what they're taking and they can assess that properly. And that's true. We do need more studies. I'm not saying that there's enough evidence for cannabis, but there is plenty of evidence out there. And you've got to think of these children have used every possible licensed medication. They've been considered for things like diets and surgery, and the doctors turned around and said, there's nothing more we can do. So why in those circumstances, with the evidence and the safety, don't doctors prescribe cannabis, which we know works really well for many people who try it?
So, Professor, when you weigh up the benefits against the concerns, and we're talking about the lives of Charlie and Alfie there, what is your conclusion? What would you say to Charlie and Alfie's parents about what they're doing and how they are finding the results that they are seeing?
But it doesn't surprise me that the children like Alfie have remarkable improvement on cannabis. And the important thing about it for any doctor prescribing is whether it's safe. And we know that when it's prescribed sensibly by a qualified and knowledgeable doctor, then cannabis is remarkably safe. It's not the right medicine for everybody. We know who to use it for and who not to use it for. But for heaven's sake, for the children who've tried everything else, let's try cannabis, see if it helps them, prescribe it sensibly, and let's get on. And many, many of those children will be improved immeasurably.
Matt, let's talk about your campaign again against NICE, bringing them to court. Department of Health and Social Care, they're saying this today. They say the decision on whether to prescribe medical cannabis is ultimately one for the clinicians to make. Now, that obviously is true, but it's not happening. So they say, well, you can if you want. So why is it not happening?
Well, again, it just goes back to the guidelines. So Charlie, there's different regulators. So you've got the British Paediatric Neurology Association with their guidelines on prescribing cannabis. Now, Charlie does meet those guidelines, as do hundreds of other children, but they're still not receiving the medicine. So ultimately, it just goes back to the NICE guidelines. They're just too restrictive, and it doesn't, cannabis is very new to doctors in the UK, and it's new to trusts, and they just don't have the confidence to prescribe until NICE and regulatory bodies kind of open up and start allowing.
Hannah, one of the concerns is it's often cited, yes, but you could be leading these children to being stoned. What would you say to that?
I would say come and have a look at these children when they've had seizures and they've been in hospital, high as kites on pharmaceuticals. I've seen my child stoned out of his mind on steroids and clobazam and loads of other horrible pharmaceuticals that he used to have to take when he had that hundreds of seizures every week. He's not like that now. If you use, as Professor Barnes said, if you use medical cannabis correctly, if you use high CBD and low THC products for children with epilepsy, all they do is have happy lives. Their seizures are reduced. My child is a happy little boy who is, getting so much more out of life. And that's why I campaign in this way. So, ardently, because it's not fair. If my child can have this prescription, then all these children. And what I would say is that these children have been on private prescriptions for 18 months. They are the evidence. They are showing their doctors every day that their children's seizures are reduced, that they're not in hospital, that they're not in intensive care. And these doctors are saying, well, we're not allowed to prescribe. And that's the problem. Trusts have no confidence. They are not allowing their doctors to prescribe. They are blocking their doctors. And this is just unacceptable. And as you say, we've heard Matt Hancock's platitudes in the House of Commons saying, oh, yes, doctors can prescribe. It's nonsense. It's not true. And Matt Hancock is responsible for this mess. He's promised us 18 months ago to sort it out for these families. And actually what he's doing is ignoring us. We've written to him. We've told him legally how he can help these families, and he's ignoring us. He can actually set up a fund like David Cameron did for the Cancer Trust some years ago for cancer treatments. He can do that. He can help these families, but he's choosing not to. And it's utterly disgraceful that he's turning his back on these vulnerable people. And
last word to you, Matt. How much is it costing you and your family to provide Charlie, who's only 3, with cannabis, paying it for it privately?
So initially, right at the beginning, so 18 months ago, we were looking at £500 per bottle. But as time's gone, the prices have reduced, so it's currently £300 a month that we're paying.
Yeah,
Professor, I'm listening to all of this, and I'm hearing from the medical authorities that they're worried about the risk. Worried about the risk there is to humans on this. And I'm looking at 2 parents talking about their 2 children. And those children could die at any stage during the day. They have multiple fits, sometimes over 100 fits. Could the risk of cannabis really be worse than the risk of not prescribing them cannabis?
No, cannabis is remarkably safe. We know there are some people who shouldn't be prescribed cannabis, those, for example, with schizophrenia or psychosis. But for the great majority of the population, it's quite safe to prescribe by a responsible doctor who knows and understands cannabis. And we shouldn't forget, there's more we know about the safety of cannabis than any other medicine in the history of man. And the reason for that is 165 million people on this earth use cannabis every day for medical, spiritual and recreational purposes. 165 million people. There's not any pharmaceutical product that can be introduced that has that depth of experience and knowledge of its safety profile. It's not safe for everyone, but it's safe for the great majority, and it works for the great majority. We must try it.
Thank you for your analysis, Professor. Hannah and Matt, thank you. Really interesting to hear your story. Everybody will have an opinion on it. But just imagine if you were in their situation, if you were in the situation of Matt and Hannah, what would you do?